Let's face it, health insurance is complex and often filled with jargon that can seem overwhelming and intentionally confusing. So whether you're a seasoned professional or a total newcomer to the workforce, keep watching this video as I'm going to provide you a guide for everything you need to know to navigate the world of employer health insurance. Let's start with the basics. Typically, employer health insurance is provided through a group health insurance plan. This is where your employer collaborates with insurance companies to secure a beneficial deal for you and your colleagues. They usually cover a significant portion of the premiums, and you often contribute some amount as well. There's 3 key players involved here. Number 1, your employer. They're the one who's offering the health insurance plan. Number 2, the insurance company, and they're the ones who are actually providing the coverage and handle all the paperwork. And number 3, your healthcare providers. This includes doctors, hospitals, and other medical professionals who provide you with healthcare services. These players work together to ensure that you have access to the care you need. But what about the cost? With a group plan, costs are shared between you and your employer, meaning you will contribute a portion of the premiums through deductions from your paycheck. Costs can depend on things like the size of your employer, the type of plan you choose, and even where you live. Now, a few common ways that your employer may be contributing to your healthcare costs are through a percentage-based contribution, and this is when they usually cover a fixed percentage of the premium cost, often 80%, with employees paying the remaining 20%, keeping the employer's contribution proportional to the overall cost. Another way is through a tiered contribution. They may offer variable contribution levels for employee-only or family coverage, enabling employees to select suitable coverage with employer financial support. And a third way is through annual contribution adjustments, where they can annually adjust their contributions to accommodate changes in healthcare costs, inflation, or other factors affecting the affordability of health insurance plans. The specific details of your employer's contribution policy should be outlined in your employee benefits package. Be sure to review this information to understand how your employer supports your health coverage. There are a few things to keep in mind. Employers usually set participation requirements for health insurance plans to spread risk and maintain affordable premiums. They often require a minimum participation threshold, for instance, 75% of eligible employees. Eligibility for employer health insurance can depend on several factors, from being a full-time versus part-time employee. Some employers may have waiting periods before employees become eligible for health insurance coverage, and dependent coverage. It's crucial to review your employee benefits package to understand the specific eligibility requirements and coverage options that are available to you. Now that you understand employer-sponsored health insurance better and know what to watch out for, let's discuss the pros and cons. Some advantages. Group benefits often grant access to a broader network of providers and services. The financial burden of health insurance premiums can be eased by employer contributions, and compared to individual health insurance, employer-sponsored plans typically have more straightforward enrollment processes. These advantages make employer health insurance an attractive option for many employees. However, it's essential to be aware of the potential drawbacks. Group plans are usually limited to the insurance plans offered by your employer, which can restrict your options. If you leave your job, you might lose your employer-sponsored health insurance. Additionally, employers have the ability to make changes to health insurance plans, which could potentially affect your coverage and costs. Understanding both the advantages and disadvantages of employer health insurance can help you to make informed decisions about your healthcare options. While employer health insurance is a common option, it's not the only choice available to you. Some alternatives are individual health insurance for those who are self-employed or don't have access to employer-sponsored coverage. Public health programs like Medicaid and Medicare provide healthcare coverage for individuals who meet specific eligibility criteria. And of course, our way of doing things through an ICHRA, or an individual coverage health reimbursement arrangement. So there you have it. You've leveled up your knowledge and you're now a pro at understanding employer health insurance. Remember, the most important thing is finding a health insurance solution that works for you and your budget. Thanks for hanging out with us. If you found this video helpful, give it a thumbs up and don't forget to subscribe to our channel for more health insurance content. Until next time, take care and stay healthy. I'll see you soon.